Trying something a little different this term. Let's complete a case study related to Chapter 2. I've also included a PDF within the LMS so that you can download that if you prefer a written copy in front of you. For today's case study, Mrs. Z, a 70-year-old woman, arrives to the emergency department with shortness of breath. She's admitted to the critical care unit with decompensated heart failure. After 2 days in the critical care unit, she is not responding to treatment and is emergently intubated for respiratory failure. Over the next 2 weeks, her condition declines. Her ventilator settings need frequent adjustment as her respiratory failure worsens, and she becomes hemodynamically unstable. During the third week of the critical care unit, her renal function begins to fail. She progresses to acute kidney injury and is placed on continuous renal replacement therapy, a continuous type of hemodialysis therapy that filters her blood to substitute the function of her failing kidneys. Her condition continues to deteriorate. Mrs. C does not have an advance directive regarding her health care and decisions for the plan of care. Her relatives are two nieces and a nephew who are all adults. The eldest niece is the spokesperson for the family. She relays information to her siblings, and the family is often observed consoling and supporting each other. A meeting with the family and her healthcare team is held. During the family conference, the provider advises the nieces and nephews that they are responsible for making healthcare decisions, because Mrs. Z does not have an advance directive. They are told that efforts in treating have been futile, although Mrs. Z is not expected to improve. She could remain on life support for an extended period. The options of terminally weaning to slowly eliminate life support machines and medication is discussed. Her first niece believes that Mrs. Z would not want to live the rest of her days hooked up to the machines and tubes, and wants to proceed with terminally weaning. The nephew states that he thinks that taking this action would be killing her, and adamantly opposes the idea. The second niece opposes the plan for terminally weaning because she says that she is just not ready and wants to give her aunt every chance she could possibly have to live. Given the differences in goals, a consensus could not be achieved. After 30 minutes of discussion, the family conference ends abruptly when the nephew tearfully turned to his sister, stating, "You just want to unplug her," and left, slamming the conference room door. Moving on, let's take 15 minutes and complete the 5 questions below regarding the previous case study. I'll go ahead, if you wanted to take a second, go ahead and pause the video, and then you can resume when you're ready, when you guys are all complete, and we can go over the answers. Alright, question 1 asked, what are the important family assessment findings that warrant follow after the family conference? And what might be reasons for the family's reactions to the discussion at the family conference? There are going to be multiple decision makers, ideally the two nieces and the nephew, and they have potential differences in either religious or spiritual beliefs that are leading to conflict among them. The family appears to have a strong relationship with good communication. However, the family conference revealed potential dysfunctional family dynamics given the differing opinions. The family's reaction may be related to a number of factors, some of which could include the stress of the critical care environment, opportunities for improved communication about the patient's prognosis earlier, in addition to spiritual and religious beliefs, combining with coping mechanisms or the patient's rapid decline. For our second question, what nursing interventions could be implemented to address these assessment findings? You could provide the family opportunities to be near their loved one and have private moments with the patient. You should also continue to allow the family to ask questions and facilitate additional family conferences as needed. You could also offer spiritual and religious support, such as through the hospital chaplain, and could help to promote coping strategies and allow the family the opportunity to have a quiet place to discuss the goals of care when they're ready. You could also listen when the family is ready to discuss any fears, address concerns, and provide resources such as palliative care consults to facilitate these end-of-life discussions. Also, recognize the unique experiences and reactions of each family member and determine the best way to communicate and help intervene with each of them. Also, encourage the family to communicate and for the spokesperson to share updates with other family members. For question 3, after performing nursing interventions, what assessment findings would indicate the family dynamics have improved? The niece and nephews are communicating with each other, and the spokesman is providing frequent updates to the family. A family conference is either proposed and accepted or requested and includes both nieces and the nephew. The family is able to demonstrate mutual respect. The family is also able to come to a shared decision making, keeping Mrs. Z's wishes in mind and aligning with what she would have chosen if she was able to make her own decisions. As a follow up before the final two questions, it asked, at the next family conference, the family requests the presence of the palliative care team to better understand terminal weaning. 2 days after the conference, the family unanimously decides that terminally weaning Mrs. Z from life support is the course of action the patient would have chosen if able to make her own decisions. They're gathered at the bedside, leading us into question 4. For a family member to change his or her decision at the last minute is not unusual. How could the nurse intervene if one of the family members suddenly starts to request a reversal of the decision? You'd want to reinforce the information that you and the other healthcare providers have given him or her regarding the patient's prognosis. You also want to request the palliative care team come to the bedside and assist in answering the family members' questions. Also, encourage the family members to express their feelings and reflect on why the decision was made to pursue terminal weaning. Finally, consider offering those pastoral care services or the chaplain, again, come to the bedside to meet any spiritual or religious needs the patients may need. And finally, for question 5, when Mrs. Z's vital signs indicate that death is near, the family requests the nurse to come into the room and stay with them. Should the nurse go to the bedside? Why or why not? The nurse should evaluate the family and make the decision accordingly. If the rest of the family agrees, it may be a comfort to have a trusted nurse in the room. Once death occurs, it may be better to leave and allow the family to grieve privately. However, one of the nieces or nephews does not want you in the room, then you'll need to honor that wish. If that's the case, then you'll want to be near, but not in the patient's room, to enable the other two members to contact you if needed. In addition, investigate the need for spiritual support from, again, the chaplain. Otherwise, that's all we've got for this case study.